Okay, so it's recording for anybody that misses it this morning, didn't make it or whatever. My name's Bill, and as you might know from our previous class, and then there's Amanda. Bryce is not here today. He had to go out and do clinical rotations with the seniors out at Heron's Key, which is one of our assisted living places that we can go to right now that has opened up for us. That will happen for you guys also here towards the end of the summer quarter, where you will be going out on Wednesdays and Thursdays and going to clinicals and taking care of one patient at a time right now for clinical one. And that'll be happening probably the week of the 21st and 22nd of July. And then we'll go out for 2 days a week for the 4 weeks that are left there in the class and get that taken care of. So if there's any change to that, I'll take and let you know. All right. So one thing that we're going to do today is we're going to go over the syllabus. And let's see, that's right there. And I'm going to share it so everybody can see it. Can you all see that? Thumbs up? No? Yes. Down, up, down. Okay. I never know because I've got 3 screens. So I got, my computer screen, I've got the other screen, and I've got the screen over here. So I don't know if one of them's being shown or not. So PNUR 223 Med-Surg Nursing 1, summer 2021. It's mainly online. Office hours by appointment usually. My cell phone, you can always call me on my cell phone. This phone number is wrong, Amanda. 7297, I don't know whose that is.
Okay, I'll change it.
But maybe that's
maybe that's Eileen's.
Eileen's, I don't know. That might be. But there's Bryce's and there's Amanda's. Okay. So prerequisites of the passing with a grade of 3.2 GPA or higher in introduction to Med-Surg, as well as other quarter 1 LPN courses. Course description. This course provides an overview of the care and management of the patients with hematological immune-mediated disorders and introduction to neurological disorders. So the main ones that we're going to cover for neurological disorders are CVA or stroke, Alzheimer's, Parkinson's, and dementia, which Alzheimer's and dementia are basically the same thing, but they show up differently. So we're going to talk about that and that. So we'll go over the pathophysiology, the etiology, clinical science, medical and surgical management, along with gerontological implications. Now, this is really important for the gerontological implications because of the simple fact that most of the people that have Parkinson's, Alzheimer's, dementia, and CVAs, strokes, are usually in the elderly population, but you can also have people that are young that have strokes. And usually that is related to a AV malformation in their brain, that the atriovenous malformation, where they connect, it sort of blows up and pops, and that causes them to have a stroke. It also comes from using recreational drugs sometimes, so you have to be careful with that. The youngest person I have ever taken care of with a stroke was 22 years old, and so Bates LPN program uses Dorothea Orum's nursing theory of self-care and concept framework. I'm not going to read all of it to you. You can read that. You need to know that because if the state comes in and says, well, what is your theorist theorist for your program, you want to say, oh, it's Dorothea Oram, okay, the self-care and that type of stuff for them, okay. Course outcomes, perform an assessment and provide the delivery of entry-level practical nursing care for clients with the disorders within each of the following systems. And there you get those systems. I identify multicultural values and beliefs and religious beliefs across the lifespan that can affect how you take care of the patient. Identify normal and abnormal anatomy and physiology. Okay, and Bryce goes over that real well and talks to you about that and some of the things that we do. Identify differences between chronic and acute pain, including interventions for pain relief, traditional and alternative therapies for pain relief, and cultural diversity differences. Now, this here is quite a bit of difference depending on how people were raised. I know that I grew up in the desert Southwest, and people of the native tribes down there, Navajos specifically, it was a sign of weakness if a woman giving birth made any noise. So they did, you know, going through pain, going through labor. I mean, it's painful. I mean, my wife and I have had 2 kids, and I was there, and she was grabbing my hand and hurting my hand, you know, when she'd have contraction. So I know that that is a painful situation, but it's just how people show their pain, and that you have to take what they say the pain scale is as what they are experiencing. Okay, it's not what the person looks like or how he acts or she acts. It's what they say it is. Okay, so we'll talk more about that. Identify signs and symptoms of hemopoietic diseases, hemophilia, you know, anemias. We also go over sickle cell anemia. That's one of the anemias that we go over, which is a very prominent in our culture of Black Americans and Mediterranean people from the Mediterranean also suffer from sickle cell, and we'll go over that. Identify the signs and symptoms of immune disorders, types of immunity. We'll go over that. Okay, what is the immunity that we have on that? Sorry about that. I'll turn my phone off, I guess. Allergic reactions, what you're going to do. HIV, we're going to cover HIV and AIDS. What's the difference between the two, you know? And we'll discuss when somebody...
Kimberly, hebu kidogo.
Hello? So then, like I said, we're going to go over dementia, Alzheimer's, and Parkinson's.
Hebu consistency imemute wapi?
Make sure you're muted.
Don't unmuted you.
You need it. Are you asking a question there? Oh, okay. So core concepts that we're going to cover in this course is tissue integrity, physical assessment, neurological, oxygen, culture, oxygenation, perfusion, immunity, cellular regulation, infection, and thermal regulation. So those are the big ones that we're going to cover, okay? The outcomes, the CNEA objectives that we have, and they go with our program student learning outcomes, and these are them, and they tell you which ones are involved. The book is Tim B's, of course, Introduction to Medical Surgical Nursing, 12th edition from Walter Cooler. And then ATI, book Content Mastery Series. And that, so there's the 10th edition in that. And then the point, the VSIM nursing, medical surgical nursing that we're going to have for those. Required technical skills, learn to navigate the LMS that we have. Coursework, all coursework needs to be turned in, period. Whether it's late, you get points for it or not, it all needs to be turned in, okay? This course is organized fully online. Please refer to the Canvas courses as a guide for class preparation. Assignments, like I said, student support course grade is counted as 5% of your grade, and that is mainly Amanda, right, Amanda?
Yep, just like last quarter.
Yep. Attendance will be evaluated based on a weekly discussion board participation, counts for 5%. Several assignments need to be completed as assigned. These assignments will collectively be 20% of your grade. The remaining 60% of the grade is from 3 module tests, quarterly tests, quarterly quizzes, and the cumulative final 30% of your grade. Okay, so there it lays out there. Okay. So then we got the grade breakdown. Okay, so 80% is the goal percentage grade that comes out to 3.2, which is a B. Okay. The iBest, which is Amanda. She is the best.
So iBest is just describing the support course and how I support you within each of the classes. And then I have to report attendance to the state board. This just shows what I'm reporting attendance for. You don't really need to worry about this. And if you have any questions about it, you can ask me. But basically, this is just outlining how I give you attendance hours that I report to the state board for iBest, which is the nursing support.
Okay, so course policies, they're all listed in the Practical Nursing Handbook. If you don't have a copy of that, let us know. We'll get you a copy, an electronic copy, and give that to you. Students arrive late to a test without prior notification to the instructor will not be given extra time to finish the exam. So if it starts at 7 o'clock and goes till 9 o'clock, you show up at 8 o'clock, guess what? You got from 8 to 9 o'clock to finish the test. Okay. If you are going to miss a test, you need to schedule the exam without prior notification to the instructor, regardless of the reason. Will receive a 0-0 for the exam. And that is a large hit on your grades. So, you know, if you're going to be late, you have to notify the instructor, Bryce, Amanda, or myself, and let us know that you are not going to be at the test for one reason or another, and we can arrange for an optional test that you can get and take at another time, okay? And it has to be at least 30 minutes prior to the beginning of the test, okay? And it talks about scheduling the instructor to take the test within 96 hours or 4 days of the missed test. Okay. And you will receive a maximum of 80% no matter what you get. Okay. So, but if you get less than 80%, that's what you're going to get. But if you get more than 80%, say you got 90%, you're only going to get an 80% on the grade book. Okay. In certain circumstances, the instructor's permission, the student may be eligible to take the test prior to the scheduled date and earn 100% of their score. All right. So, you know, when the tests are, they're on their calendar. No hats, outer coats, jackets. This is when we're in on face to face. I mean, you know, there's HonorLock that we use for online education, and you have to go by the HonorLock rules and regulations. And using that, when you're using the HonorLock and the Proctorio, you have to disable the other one. So if you're using HonorLock, you have to disable Proctorio. If you're using Proctorio, you have to disable HonorLock. Okay, we had some issues with that this last quarter, and that with people that were unable to take the test until we disabled one or the other, and then they were able to take the test without a problem. Okay. It is a student's responsibility to ensure they have access to a laptop computer with a minimum capabilities of allowing online proctoring included, but not limited to allowing for browser extensions. So you have, and we ran into this when we first started using HonorLock, that people were using computers from their work or from their husband that they couldn't put on the extensions. And when we first started doing that, we made accommodations for that. They had to take a Zoom test where I sat and watched them while they were doing their testing, and they had to have their cameras on and all that kind of stuff. So you need to have a computer that has a camera that is able to see that, or you can get a plug-in. You can go over here to the library. The library has cameras that they can plug into the computer, a USB port, and they can do the cameras that way. Okay, so there are ways around it. Okay, it is a student's responsibility to ensure they have access to reliable high-speed internet while taking the test proctored remotely. Okay, rationale writing, anything that is scored under 50 with 50% or greater of the class that missed that question, we will offer question writing, rationale writing. It's worth 2 points. 1 point will be awarded for the writing of the rationale. Please note the final test will not be open for rationale writing. So for a 25 question, you get 3 questions that you can write rationales for. 50 question exam, you can take 5, okay? Late work, and that assignments that are submitted late prior to notification of the instructor will receive a 0. Students who notify the instructor at least 30 minutes prior to the due date and time, the assignments are eligible to turn in late. And then we have our assignments example down here on the bottom. So assignment is due at 1500 on Monday. You turn it in at 1501 Monday to 1500 on Tuesday, you automatically get a 10% reduction, and so on and so forth. So 10, 20, and then after 3 days, you get a 0. All assignments must be turned into Canvas. All assignments must be completed, all as assignments regardless of the grade attached. A student with incomplete assignments is subject to a decrease in their professional behavior assessment. Okay. Extra credit and ATI proctored exam on med-surg nursing, just like you had with Intro to Med-Surg. It's proctored synchronously, so I sit and watch you to give you practice on the NCLEX style questions, as well as the opportunity to earn a few extra points. See Canvas description. So if it's 50, if you get a 50%, 50 to 60, you get 2 points, 61 to 70, you get 4 points, and so on and so on and so on. So it can help you, and that will be added to your final grade because it's the week of finals that we have that test. Okay. And what
and Bill, this one's going to be proctored. Last time they didn't have it proctored, so this one's going to be proctored.
Yeah, I proctored it last time.
An Intro to Med-Surg.
Yeah.
I don't think they ended up having it proctored.
Yeah, I was there. So, but it's proctored using Proctorio. And even though it's Proctorio, you have to still have somebody watching them. So, so that is, and those points will be added as fudge points to the end of your final test. So it'll give you extra points on their final test there that you can actually come up and do better on, okay? So absences, you see this student handbook on that, per the WAC, which guides everything we do in school, you know, and revised codes of Washington. Attendance policy, you know, you have to attend things to learn, okay? Classroom conduct, all students are expected to follow Bates Technical College behavior checklist and rules of conduct. And that's in your student handbook that you get. Academic integrity. Now, this is something that if it happens, and that we can expel you from the school, and that, so don't do it, okay? Do your own work. We do allow you to do med cards, share med cards with each other. That is fine, but as far as writings, your other assignments, no, okay? Bates Library, those guys are over there. They're there to help you. If you have problems and you can't get a hold of Amanda, who is the guru when it comes to APA format, you can go over to the library and the librarians will be able to help you with APA format. Disability, the bias on the basis of disability, no student will be excluded from participation and be denied the benefits of or otherwise be subject to discrimination under the law. We have disability support services. Now, if you need an accommodation for taking tests or for doing things, go over to the disability support services and they can write you a disability accommodation that will allow you to have extra time on tests and things like that. So you can go over there and just use their services if necessary. And they give you your phone number right there, okay? Okay, non-discrimination agreement. We don't discriminate. Net etiquette, no all caps. That's like yelling at somebody, okay? So we don't want to do that. Do not respond to any posting with I agree, no, me too. Please respond with complete thoughts explaining why you agree or disagree with the person that's writing the posting, okay? And that's spelled out in the rubric for the postings, for the discussion postings. College resources, we have My Bates, we have advising, e-tutoring, tutoring services, veteran services. We've been, since 1940, Bates has been attached to the Veterans Administration. So we have a good response with them. So try to keep it that way, okay? And that's it. So there is a, okay, gotta get down here. Come on, there we go. So any questions on that? Isn't there a test on that somewhere, Amanda?
Yeah, there's a syllabus acknowledgement quiz
Yeah,
that is due soon that everybody will have to acknowledge that they went over the syllabus and understand it.
Is that
that's why
the one that's due July 6th? It's not highlighted in there. You can't
Yeah,
click on
it's
it.
due
but I was
July
gonna-
6th.
It says
Yeah, it's
July.
not highlighted. Like I tried to click on it to look at the syllabus while he was going over it. So I can't see it.
What do you mean it's not highlighted?
Like it's not turned on. I can't access it.
Oh,
I don't know.
that's weird. It shows it's published. Can you try it again?
Yeah. Yeah, no, it won't let me pull it up. Weird.
You
Did
didn't
anybody
do
else
the
have any-
other stuff beforehand, it won't let you. There's like 2 other items that have to be checked before it unhighlights it.
Yeah, Lisa, you have to go in order in the course in order to see everything. So start from the top of that module and click next as you go through each one. Thanks, Alyssa.
Okay.
And then that'll allow you to get it. I can get it because I'm an instructor, and same as with Amanda. But you guys have to go from one to the next, to the next, to the next to get it. Okay.
Okay, I see it now.
Okay.
Perfect.
Great. Now, contacting the instructors, we have Bill, Bryce, and Amanda. We have our Bates email, and I and Amanda have text messaging on our phones. So I've given you my cell phone number. Just when you go to text me or something like that, let me know who you are. Because it's like, hey, Bill, blah, 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 blah. And then I'm going, okay, well, who are you?
Did you fix the number that was in there? You said it was wrong.
Yeah, I fixed it.
Okay.
It's fixed on the syllabus. It's correct on the other page, right, Bill?
Yeah. Well,
Yeah.
I put the cell phone number in, so I know it's right.
But I fixed his office number on the syllabus, so it should be good now.
Yeah.
Bill, do you want to share your screen? Are you going to go through Canvas?
Like this. So
Yeah.
this is contact your instructor, email, Canvas messaging, text messaging, Zoom, office hours, or by appointment. Okay. Now we go down here and go next. Hopefully it won't drop you. And this has my office hours on here. Bryce probably won't have office hours during the week because he's at clinicals with the seniors on Monday, Tuesday, Wednesday, Thursday. So Friday will be the only day that he will be available for office hours. And there's the dosage review with Amanda, Tuesdays at 8 a.m. Very helpful for you to take these quizzes. You have to take and pass each quarter. Moving forward, you have to pass your dosage test at the end. And that, so. Let's see, 90%, yeah. It has to be 90% on the test. And if you don't get 90% on 2 tries, then you're put on math remediation and dosage remediation, and you will have to do turn things in every week. Live tutoring and support from Bates. Hopefully I can get back to where I was. Go this way to get past that, I guess. So major assignments. You can still see this, right?
Yes, we can.
Okay. VSIMS, the enrollment for MedSurg, you have to go and do that enrollment. I mean, you've already paid for it. It's good for a year. So just go in and enroll in the class for MedSurg 1. Then we have a Partners in Teaching, a patient teaching project on pain and opioids.
Actually, sorry, Bill,
other things.
let me interject something here. So one of the topics is pain and opioids, but then we have 3 other topics. I need to update that there. But if you click on there, it should show the correct topics.
Let's see. There we go. So you got the 4 to 5 people, click on people and at the left side, and this will take you to your courses. And that, so.
So this is a project that you're going to do in groups of 4, where you're basically practicing how to do patient education with a client. And so there's 4 different scenarios down at the bottom. And you're going to use those scenarios to teach your patient about the drugs that their provider has prescribed to them. And there's detailed information on what you should include in that patient teaching. So there's 4 people in your group because there's 4 different scenarios. So you'll pair up with one other person in your group and do one of the scenarios while that other person plays your patient, and then vice versa. So basically it's, oh, sorry, Bill, I keep interrupting.
That's okay.
Go ahead.
Okay. Go ahead.
Basically, you were just learning how to speak to a client or practicing how to speak to a client using layman's terms, but then really teaching them why they're taking their medication, how to take it effectively as it is prescribed, et cetera, and using methods that you learn in MedSurg 1, such as like the teach back method and other education methods for patients.
And then there's scenarios. You have 1 that's allergic rhinitis, and then 2 is COPD, and 3 is,
This is the pain one.
yeah, the pain one. Undergo surgery to repair a torn anterior cruciate ligament in his left knee, which I've had done, and it hurts. Yeah, knee surgery is probably one of the most painful surgeries you can ever have. Then the patient is coming with hypertension, and you're going to understand how to give tell him how to take his blood pressure medication, how, when, where, why, what it does, all that kind of stuff. It has a rubric here that you can go through, and this is what I use to grade your papers, to grade your information here. Okay, so you have to do what is in here to get full points. All right.
And there's also a description within the assignment above that tells you what you should include, such as always introduce yourself to the patient,
Right there.
and for allergy, stuff like that.
Yeah. Verify the client's name. Basically do your LPN introduction. And you have 2 identifiers with any kind of patient that you're going to tell them anything that they're going to need to know. So you're going to take and say, okay, what is your name? Okay, my name is John Smith. What's your date of birth? 5/3/56. You know, things like that. And it has to match with what information you have on that person. Ask them about allergies. Describe the interactions, side effects, and method and times of administration. So, okay, everybody understand that?
Again, you can click on people on the left side of this course and look at the groups, and you can see who's in your group.
Let me go do that right now. There we go, people. And then partners in teaching. There we go. So you can go in here and click, and it will tell you who's in what. So we have 2 that haven't been assigned.
Yes, that's on purpose.
It's on purpose. So you can go into people and you can click on the groups, and you can see who you're in with.
Monica wrote a question in the chat that says, when do we choose our scenario? When you meet with the other people in your group, that's when each of you will choose what scenarios you're going to do and who you're going to partner up with.
Are there leaders in each group?
That's the program automatically assigns a leader. And that one has the little person beside their name. So like for group 1, it's Andrea. And for group 2, it's Emma-Stella and Brittany and Jeffrey. And, you know, they've been assigned by the program itself. Program tells them, just assigns them randomly.
Yeah, Canvas randomly assigned it.
So if you guys want to, somebody doesn't want to do it, you know, you can always take and change that. Okay. Your VSIM.
Sorry, can I add something in really quick before we move on? There is an assignment due July 6th where you have to meet with your group and then submit something stating that you have met with your group and chosen the scenarios. And that was right below the project assignment where Bill was just at in that module. So it is required for all groups to meet before July 6th and turn that assignment in. That's not the complete project that's due July 6th. That's just the meeting and saying that you assigned scenarios due July 6th. Are you looking for it, Bill?
Yeah.
You go back to modules.
It should be an assignment.
Right there, partners in teaching group, get it scheduled, that one, yeah. There's instructions on what you should do in your group meeting.
And I do want to know if somebody is not participating, because that will lower their grade, not everybody else's grade. So it is imperative that everybody participates in the discussion and does their job, or their part of the job. Okay. So I want to make sure that everybody participates. Okay. Let's see where we're at. VSIM enrollment. Okay, so this is your VSIM code, and so you can go in there. It's worth 10 points when you enroll in it. So please do that. Okay. Looks like somebody already has 1 out of 1 submission graded. So this is the proctored test MedSurg 1 extra credit. And this gives you your points. So greater than 91%, you'll receive an 8 extra points. 6 for 71 to 80, 61 to 70 is 4, 50 to 60 is 2. Okay. So it adds those extra points. And this is the tech support line. I think that's what that is, Amanda, right? For ATI?
Yeah, that's the ATI tech support line.
Yeah, so if you're having trouble, don't call me, okay? Sometimes I can help you, but most of the time you have to call ATI and talk to the tech support. And if they tell you, then call your instructor, then call me. I'll take care of it, okay? Pre-lecture quizzes. Each week you will have 1 pre-lecture quiz with 2 attempts that are due on Tuesday, the week of each class opens. Okay, and they're pre-lecture quizzes, so they will go over what's covered in the lecture. All right, make sure that you get your reading done.
I'm going to update something on this. There's, I think, 2 attempts on each of these quizzes.
Yeah,
It says that you have to take it one by the first day, but you don't. We changed it so that both attempts are due by the day that everything is due in the class for each week. I thought Bryce was going to update this. So basically both attempts are due the Tuesday after it opens. So the week opens, like say today, next Tuesday, this pre-lecture quiz will be
will be
closed.
due.
Yeah.
So then your weekly objectives, reading assignments and quizzes. You know, there's the lecture, pre-lecture quiz, discussion board attendance, week 1. So, and that's basically the way it's laid out. Okay. Any questions?
Did you enjoy your break?
Yes.
You guys had a break. I haven't.
Are we, Bill, are we gonna be using the same vSIMs we used last quarter?
No, they're different vSIMs.
Okay, so I was looking at, I think it's Amanda who shared the books that we have, and I think it was only one book, the pharmacology book.
Aisha, you don't have to buy another vSIM. He just means you're going to have different vSIM scenarios. So you're using the same MedSurge vSIM that you bought last quarter for this quarter
Okay,
in the same book. The only book that you would need to buy this quarter if you didn't already buy it is the pharmacology book.
okay, thank you.
Yeah, I don't have anything to do with pharmacology.
Also, I wanted to say earlier when we were talking about the dosage final, the dosage final is in pharmacology this quarter. So the 90% or higher that you have to get, you'll be taking that dosage final in pharmacology.
I was looking at your, there's like a paper we're supposed to be starting to write by this Friday. Where's the template for that?
So when you open that assignment, there's a template down at the bottom. It's in Office 365. It's a tool and you just edit it directly in Canvas. So Lisa's talking about an assignment in support that has to do with the paper that's due in pharmacology.
Yeah, I tried that yesterday and I couldn't. So I was hoping you would be on the Zoom today to show me.
You have to be logged into Office 365. So if you're not logged into that, try that.
I am, because it stores all my bait stuff.
Oh,
So I don't know why it won't do its thing.
I don't know if this has anything to do with what Lisa's experiencing, but when you on support, when you go on to the waivers assignment, it doesn't open the 365 link. You have a link on there, but it won't open it.
Yeah.
so Monica, you couldn't fill out the form?
No, because on that assignment page, I was trying to click on the link that you have on there to get the assignment started, and that link won't open anything.
Can you go to, you know how in Canvas it says Office 365 on the left-hand side? Can you go there and maybe it makes you log in through Office 365 in Canvas?
Okay, I can try that. And then I do have another question too. This is my BLS is going to expire in August. And Bill, can you tell me where to find the information for the CPR and BLS training through Bates?
Right now we've got a class on Friday. The 18th, we got a class. And there's only 3 people registered for it. So, I mean, there's plenty of room there. We have not done one for July for the BLS side. So we can figure that out.
Okay.
It's gonna be busy because I'm also doing the first aid CPR, and that for basically the whole school down here, barbering and all that kind of stuff. They don't need the BLS, they need the first aid and CPR. And that's a full 6-hour class.
What are
So
the hours for Friday's class? For the
8 to noon.
8 to noon. Oh, okay.
Just call Julia and Julia can put your name in on it.
Okay, thank you.
Okay.
No, it didn't work, Amanda.
Okay, I'll add
I'm logged into the 360 on both places, on my computer and through Canvas. So I don't know. And it says an error occurred, please try again. There's like a big red X. So I don't understand.
It's weird because other people have been able to turn it in that way. Hey, Bill, can you change it so that Lisa can share her screen?
I won't be able to because I'm on my iPad and then I'm looking at the computer, but let me see if I can log on the computer to whatever. That's why it's not, you won't be able to see it.
Or Lisa, can we make an appointment to meet separately?
Yeah, you want to do right after?
I can't do right after, but I could do later today if you have time later today.
Yeah, I just want to get started on my paper sooner than later because it takes me 5 times longer than everybody else to do my writing.
You know how it has the example example student paper in there? You could use that as the template for now.
Okay, I was gonna go in our old thing and grab a template, but I can't get
Well,
into
either
old
way,
class
but it's
yet.
probably easier to use the example student paper and just erase all the stuff that's in there.
Oh, it just says not to.
No, it says not to plagiarize anything. You can erase all
Oh.
of the writing that's in there and use that as the template. That just meant don't take what they wrote and use it as your own. Like,
Yeah, is our other nursing support course closed completely? Or can we get back
no,
in
you
there?
can get back in there.
Can we? Because I think there's a template in there.
Yeah, you can
Yeah,
use
I
that one.
can. I can still, I guess I could take the template out of there.
Yeah, you
'cause
can.
You put one in there.
Yep, you can.
Yeah.
Monica, did you
So
say
was
something?
there gonna be a problem turning it in?
What happens when you try and press, can you press submit on that assignment? Or what does it look like?
Let me go back in there. All these getting out of things and going back in, okay. Let's see here.
I think I was able to get into mine. I'm going to share my screen when you say okay, and then I
Yeah.
believe.
Can you make it so
I
she
got it,
can?
multiple people can share screens, so.
Okay.
It says click load to load your cloud in the assignment. And I click load.
Monica, you can share your screen if you want to. Yeah, and
Yeah,
then
it
what
doesn't
happens,
do
Lisa?
anything. Yeah, it says click load and it doesn't do anything. It just goes right back to an error has occurred, try again.
I wonder if it has something to do with your browser settings or something.
Oh, no.
Yeah, it's because she uses an Apple product.
No.
She's on her laptop.
Just kidding.
Yeah, I have an iPad to do Zoom, but I had to buy a laptop just for this class. So it's brand new.
Monica, are you able to share your screen? Well, I can,
I'm sorry, Amanda. I'm trying to get it to where I can just pull up Canvas without everything else showing.
oh, okay.
I believe I'm on it because it does say it shows the files and it shows the things I need to see, I believe. So I think I'm there.
Okay.
Yeah.
I'm going to set up a Zoom for this afternoon, and I'll send out the link to it, and anybody who needs help accessing it can come to that Zoom, and I will help them get access to that assignment. And if for some reason they can't, then I will find an alternative way for you to turn it in.
Okay. And I was able to go through the 360 link on the left side, not through the actual assignment page on the modules.
Okay. Thank you for letting us know.
You know what's weird though, Amanda? My 360 link shows my classes from TCC also.
I wonder if that's what's the problem. Maybe we need to fix your login to Canvas.
I don't know. Cause like,
Or if you're logged into Office 365 for TCC instead of for Bates.
well, that's weird because I'm logged in my computer for Bates.
Yeah, but you might have to log out of Office 365. It does the same thing for me if I use a computer that my kids were using for Office 365 for their class, their school, and then I use the computer. It doesn't.
But that's
somehow
the
it
weird
makes me log
thing.
into two at a time.
I just bought this computer like I started I logged into it and fixed the computer like 3 days before we started school with Bates. So it has nothing to do with TCC. So
But if
that's
you
weird.
logged in using, like if you had Gmail or Google set up to automatically save your settings and you logged into there, it might have saved your settings for Office 365 also from TCC. I don't know. I can look at it
Yeah,
with you later.
it's
though.
weird.
It does that because that's what happened with me. It logged into my work email and I couldn't even get it to like lock out of that. Every time I click on that link, it keep going back to my work email.
Yeah.
So I was having a problem with my laptop as well. So I have to like log in from other computer later on, and somehow it managed to switch back.
Log you back in. I know, isn't
Yeah.
that annoying? Office 365 needs to fix that problem.
Huh.
Or automatically log you out so that you can log in with the one you want.
I had another question for Bill when you guys are ready.
Okay.
You mentioned earlier that if the state comes into one of our clinical sites, we have to answer certain questions. Will you give us any more prep on those type of questions that they may ask us, or?
Yeah, I mean, if
Oh.
they ever show up or come to see us, you know, we'll be discussing what needs to be said
Okay, thank you.
so that we answer the right way. When I worked in the hospital, we used to have JCO come in and they would say, now remember, if they ask you this, say this.
Okay.
So that we're all on the same thing here.
All right, I have to go, but I will send out a Zoom link for later today, 1 p.m. if anybody wants to show up for help with anything.
Okay. I was able to log in.
Oh, yay. Okay. Talk to you later. Bye, guys.
Bye, Amanda. So anybody else need any questions or answers or that I can help you with?
I do have a question
Yeah.
about the group project. So I know the group of 4, but we have to pair up with someone else. So are we being great on what the other 2 people do as well? Or is it just with you and the partner that you pair up with?
It's with the 2 people that are paired together. Those are the people that's your grade.
Okay, so our grade is based on the people you work with, not the other 2 that, okay, thank
Correct.
you.
Yeah. Anything else? All right.
So how do you tell who you're paired with?
That's what you guys discuss when you're at that meeting. You get it all set up with. You guys decide who you're going to work with.
Okay.
Fawn, is there any way I can get your number? It's Aisha.
Yeah, I'll email it to you through Canvas.
Okay, thank you.
Okay, I'm going to end it. I'll put the recording on the modules. So it'll be a recorded session in there. Okay.
Thank
So
you.
have a good day, folks.
Thank
Bye-bye
you.
now.